A young adult male presented with headaches and paralysis of upward gaze. I am showing you a midline sagittal T1 weighted post-contrast MRI scan of the brain. Describe the findings.
Okay. The midline sagittal T1 post-contrast MRI demonstrates a large, slightly lobulated, well-defined mass in the pineal region. The mass exhibits intense, homogeneous enhancement following contrast administration. It is causing direct downward compression of the superior colliculus of the midbrain tectum. There is secondary compression and obstruction of the aqueduct of Sylvius, resulting in significant dilatation of the third and lateral ventricles.
What is the diagnosis? Explain the clinical syndrome related to the eye signs and the patient's age and gender.
Well, the diagnosis is pineal germinoma causing Parinaud syndrome and obstructive hydrocephalus. Parinaud syndrome, or tectal syndrome, is characterized by paralysis of upward gaze due to compression of the superior colliculus and protectal area. Germinomas are the most common pineal region tumors, accounting for over 50% of cases. They are characteristically seen in children and young adults, showing a very strong male predilection in the pineal location. Histologically, germinomas are identical to testicular seminomas and dysgerminomas of the ovary.
What is the differential diagnosis for pineal region masses? How do you differentiate them on imaging?
Okay. The differential includes teratoma, pineocytoma, pineoblastoma, pineal cyst, meningioma, and vein of Galen malformations. Teratomas are heterogeneous, contain calcification and fat, and occur in much younger children. Pineocytomas are slow-growing, well-demarcated, and tend to occur in middle-aged adults. Pineoblastomas are highly malignant, poorly circumscribed, and commonly affect young children. Crucially, calcification in germinomas is typically engulfed centrally, whereas pineoblastomas show peripheral calcification.
Describe the significance of calcification size in this region and how it relates to patient age.
Pineal calcification is a normal physiological finding in most individuals over the age of 15. However, when calcification is detected in a child under the age of 6, it is highly suspicious for a pineal neoplasm. Furthermore, a calcified pineal gland exceeding 1 centimeter in diameter at any age should raise suspicion of a pathological pineal mass.
How would you manage this patient as a radiologist?
As a radiologist, I would recommend immediate neurosurgical review for CSF diversion, such as ventriculoperitoneal shunting or third ventriculostomy. I would also recommend whole brain and spinal MRI to look for drop metastases, which are common in germ cell tumors. Because germinomas are highly radiosensitive and chemosensitive, surgical resection is usually limited to biopsy, and radiotherapy is the mainstay of treatment. Finally, I would recommend tumor marker screening in serum and CSF, including beta-human chorionic gonadotropin and alpha-fetoprotein.